This video has been produced to demonstrate how to prepare injectable medication from vials and infusion bags. It should be used in conjunction with the local procedures which you should always follow. First of all, assemble your drug, consumables and required numbers of labels that you need to make the product. Record information such as batch numbers and expiry dates on the batch documentation in accordance with the local policy. Then, familiarise yourself with the method of preparation. Before starting the preparation, you should ensure that you have removed makeup and jewellery and check that you're wearing the correct clothing and gloves for the area that you are working in. You should also clean your gloves. This poster outlines glove cleansing technique. Pause the video now if you need a quick reminder. Next, prepare the working zone. You must make one batch at a time, so the bench space must be clear of all items. Spray the disinfectant over the bench and wipe the entire surfaces using overlapping strokes. Where possible, work over a tray which has also been cleaned. Next step is to lay out your equipment. Try and do this in the order that you will work in. Check your medication is the correct drug and strength and that it is not expired and is not damaged, so look out for cracks in the glass, discoloration and particles in solution. We've used a coloured solution in this demonstration to make it easier to visualise the solution. Clean the bung of the vial and the infusion bag to remove any local contamination which could get into the dose. Once cleaned, do not retouch this area. Whilst you're waiting for the area to dry completely, prepare the syringe and needle so they're ready to use. Peel open the wrappers and connect the ends. The key part is to avoid the connections. They should not be touched during assembly, and the syringe should be held as far away from these areas as possible. You may want to mark up the diluent syringe so that it doesn't get confused with the drug syringe. First of all, withdraw the required volume of diluent from the infusion bag into the syringe. This withdrawal ensures the final drug concentration in the bag is more accurate. This volume takes into account the volume of the drug being added as well as the average overage for the brand of bag being used. Rest the bag on the surface and hold the port mid-air. Pierce the additive port in the central position with the needle attached to the syringe, taking care not to puncture or scratch the side of the additive port or bag. Make sure the needle tip is in the liquid. Remove the diluent by pulling the plunger out, then push the solution and any air bubbles back in the bag. Repeat this until all the air is removed, and then draw back the syringe plunger until the required volume is in the syringe. Gently squeezing the bag makes it easier to withdraw the volume into the syringe, as it reduces the force and pressure needed to pull back the plunger. Remove the needle, and then remove the needle from the syringe. It is important to get the volume of the diluent solution checked at this point, and then discard that syringe. When preparing a dose from the vial using a dispensing pin, push the dispensing pin through the bung and invert the vial and syringe. Pull the plunger down. If the solution contains a large amount of air, then push the plunger back up and expel the liquid and air back into the vial, and then pull the plunger down again until the correct volume of solution has been withdrawn. If significant air remains in the syringe, then repeat the process, making sure the dispensing pin is fully immersed in the liquid. The few small air bubbles that then remain should be insignificant and not impact on the volume. Check the volume is correct, and then repeat the process until the required volume has been withdrawn from all the vials. A dispensing pin can be used several times, usually a maximum of 5 times before it becomes too blunt. To check the volume is correct, gently shake or knock the side of the syringe to remove any air bubbles. It is important to get the volume of the drug solution checked independently at this point. Next, connect the drug syringe to a fresh needle. Push the needle through the diluent bag port and expel the contents into the diluent bag. Flush the syringe to ensure all the drug has been completely expelled. Next, remove the needle. Thorough mixing is essential to ensure an even concentration throughout the bag. Mixing is much more effective if the bag contains a small volume of air. Flick the additive port free from solution and refill the port with solution. Repeat this several times, inverting the bag up to 10 times or moving it in a figure of 8. As you can see from the photo, there is an uneven distribution of drug in the bag. Concentrates and denser liquids can collect in the ports and can only be distributed by mixing and flicking the drug solution out of the port. This is greatly facilitated with air in the bag. At the end of the preparation process, reconcile the products to make sure you have made and can account for the required amount. Confirm that the product has met the acceptance criteria. This may include checking that the correct volume has been added, it's the correct colour, it's free from particles and leaks and defects. Next, label the product. Ensure the product master matches the worksheet and contains the correct expiry date and batch number if it is present. Ensure the label does not obscure any vital information.